All right, I'm here with my patient Molly today, and she's coming in for osteoarthritis in her knee joint. It's super sore right now. So we finished her treatment for the day, and we're gonna do some electrical stimulation on a TENS setting, low rate TENS specifically. We're searching to get that endogenous opioid release so she can have some pain control for the next 3 to 5 hours afterwards. Indications for her are she has osteoarthritis, so we know where the pain's coming from. Contraindications with electrical stimulation, you don't want to do it over a pregnant person's stomach area, hips, or low back. You don't want to do it over the genitals, any internal body surfaces, over the eyes, or any skin with decreased sensation or a really wet open wound. So again, Molly, we're going to go ahead and do some electrical stimulation. So what I'm going to do, with your permission, of course, is put these pads just around your knee so the electrical stimulation goes in. I'll turn on the power. You're going to feel a buzzing sensation initially, and then it's going to work up to possibly feeling like a little bit of pins kind of getting pushed in, kind of like just like needles are poking you, kind of acupuncture style a little bit. That's what we're looking for. It shouldn't be painful though, so if it gets uncomfortable, let me know. Does that sound okay with you?
Mm-hmm.
All right. And are you pregnant right now?
No.
All right. So your skin looks good. I don't see any open wounds or anything. So do you want to go ahead and lay down so you can be more comfortable?
Sure, thank you.
All right. All right, so I'm gonna get the machine set up and then I'll let you know before I turn on the power.
Okay.
All right, so to set up the machine, we wanna go biphasic current. I want a continuous duty cycle. So I got that set at continuous. 10 minutes time is just fine. She's on channel 1 right here, so I've got that one picked out. For the rate, we want between 2 and 10 because we want those individual pulses to be felt in the muscle. So I'm going to go ahead and set it at 5. And for width, 200 is good because we want to actually stimulate that muscle contraction, so it needs to be 200 or higher. All right, so Molly, I'm going to go ahead and turn on the power. Let me know when you first feel the buzz, and then let me know again when we get up to that point where you're feeling that muscle contraction and it starts to feel like pins and needles, okay?
Okay, sounds good.
Doing all right?
Mm-hmm. I can kind of feel some like taps.
Okay.
It's contracting.
All right, does it still feel all right?
Yeah, no, it's not painful.
Okay, just let me know when you're at a point where you kind of feel that pins and needles sensation and want me to stop.
Okay. That's good.
All right, so I'll go ahead and start the treatment. All right, so at this point I could leave the room and the patient set to go. I just give her something like a bell or whatever so she could let me know if there were a problem. But again, it'd be safe to leave her. But I'll just hang out for a few minutes and let the electrical stim do its work. Everything still feel all right?
Mm-hmm.
All right. All right, well, now that we've cleared our 10-minute treatment time, I'll go ahead and turn the machine off. And are you all right if I remove the pads from you?
Mm-hmm.
All right, so as I'm removing the pads, I'm also checking the skin to see if there's any inflammation, burn marks, or tissue irritation. And everything looks clear on both sides.